guys, what's cracking? Dr. Eric Smith here today, and I have Britt with me. So Britt is an amazing fitness trainer who's training for a few things. So what's next on the docket?
Yeah, so I'm currently training for 3 races. I have one, my first CrossFit, so we'll see how that goes.
Okay.
Coming up in December, and then I have a half marathon that I'd like to do also in the same month.
Same month.
And then I have High Rocks, which is a hybrid workout of strength and running. So I have that in February. So I need help.
Yeah. Where's the High Rocks going to be?
Miami.
So she can do that. So I trained somebody for High Rocks. It's an incredible thing, and that'll be great for you because I think you're built for that. You got some speed, some strength, and with that, and I like that more than some of the other competitions you mentioned because it's not as hard on the body, but it's very challenging cardiovascularly. So today we're going to be treating her for a few different things. This is actually her first adjustment with me, so I think it'll go very, very well. But we have a few conditions that we're going to look at with her. So what are your biggest complaints that you want to get treated for today?
So I feel like I have a dead leg. I have a small torn labrum that I had diagnosed a few years ago, probably like 15 years ago, so a little more than a few years ago.
Okay.
I really started upping my training and stuff. So yeah, the biggest concern is my leg, the slow, dull pain in my leg. And then my hip. I sometimes feel like I have a ball in my hip, so my mobility isn't as great as I would like it to be, and it really inhibits my squat and things like that. And then my lower back.
Lower back. Okay.
Yeah. So
Sounds
I have
good.
a list of things.
So we're going to, a lot of this down here.
All
and,
this.
And you've been an athlete for a while, right?
Yeah, my entire life, I guess.
Okay.
Yeah.
So the thing about athletes with that, they always have a host of different things they probably fought through, and her level of resilience is going to be higher than usually a lot of other people. So asking deeper questions is what I like to do. And then not only, obviously, we want to get her out of pain, but we're really looking at her in terms of performance because that's really what she wants. She's going to work through a lot of the pain and get through things. And I'm one of the last doctors that's going to tell you to quit working out, so you're in good hands with that. But when you say like a ball, what do you feel like?
So in my hip.
In the actual hip itself.
Yeah.
Okay.
Squat.
Cool. So note that she said that. A lot of times people will say like my hip, and your hip is actually down here. So she's got that right. So labral tear, and then you said ACL on the side too.
Yeah, I tore my ACL.
Okay. I was joking with her earlier. We're just gonna get her a new leg and either like a wooden peg or like a metal one that we can put like something like a ski or a roller skate on or something like that. But we do things naturally and holistic here. So we're gonna do a few things first. I'm gonna want to check out some of the things with your mobility in your hips and such. So go ahead and lay go ahead and lay on your back for me first.
Head up here.
Yeah, head up there. Yep. And so when's the last time you were actually adjusted?
Oh God. 2 years ago.
2 years.
Maybe.
Okay.
I might have just made that up, but I'm not sure.
So a while
It's been
ago.
a long time.
A while ago. Gotcha.
Yeah.
So we're gonna take the good leg first and just kind of see what's going on. Let me know if you feel any pain in your like low back, or this just feels like a little tight, or what's going on.
Just tight in the hamstrings.
Okay.
No pain.
Any pain when I do that?
No.
Low
Just
back or
stretching.
anywhere?
Yeah.
Well, there's plenty of range of motion still with that. You're doing a lot of mobility stuff, right?
Not as much as I should be.
Okay.
I'm guilty of that.
So those of you that want to check her out, we'll insert her Instagram down below because that's mainly where people can find you, right?
Yeah. Mm-hmm.
And is there a certain type of people you like to work with that you train?
Mainly women.
Mainly women?
Yeah.
Like weight loss, muscle gain, body
Both.
composition?
Yep. Weight loss, muscle gain, recomp.
Okay.
Mhm.
All the above. That's awesome. So pretty good there. So what I wanted to do and check out with her is she had said that the thigh here, so right in the quad, she was having some pain / she said it felt kind of dull, right?
Yeah, like a dull, achy pain.
Okay.
Yeah.
When somebody says that and it's coming through, this is the dermatome for and maybe myotome of an L4 issue. So we want to make sure and kind of clear that she might have a disc issue or something going on. That's what we're going to try to figure out today. I won't be able to strongly confirm that diagnosis is right unless we get an MRI, but I like to treat as if. So if it walks like a dog, barks like a dog, you feed a dog biscuits, it's probably a dog. So if she's got all the things going on, that's what's probably it, and we can always get an MRI, like I said, to confirm. But let's start and make sure that we're getting her on the right track because she clearly has a big agenda and things to do. So let that relax for me. So same kind of stiffness, right?
Yeah.
Okay.
Back.
Now, when I do that, do you feel it radiate into your thigh or quad?
I don't. It's more like
In the hip?
tightness down here.
What about when I do that? Nothing? Good. Underneath?
Yeah, that's uncomfortable in there.
Feel it more in the hip.
Yep.
And then trying to open it up, it just doesn't want to do that, huh?
Nope.
Gotcha. Okay. So this is more indicative of some type of hip issues going on then. So we'll take a look when we have our lay face down to see if she has some rotation in her.
Like
Ooh.
Yeah.
Wow. Okay.
It's really bad.
All right. I'm sure you'll crush this test, but hold the legs up there for me.
Okay.
Good. Shake it off. Very good. Okay, let's have you go ahead and roll over to your stomach for me, please. Yep. Got that. So a few things I'm going to take a look at is obviously her leg length to see if there's some type of rotation or something going on. And there's a little bit off right there. Let's do a little check here, see how we're doing. Good. And there is a rotation if you can kind of see, I'm not sure how easy it is, but her pelvis basically goes like this. And looking across the plane of her body, you can kind of see that. You might even be able to see it a little bit in her erector muscles, how this side's a little bit more hypertonic and then this side is dipped in. So that type of rotation, if I look at if you look where my fingers are, you can kind of see where she's laying that one side's higher than the other. So, which is interesting, like that, but this side, left side's higher than the right side. And you are right-handed?
Yes.
Like that you put your hand up for that. Yes, sir. Yep, right over here. That's hilarious. So, any soreness in here when I push in?
A little bit. Yep, right there.
Like right in the SI joint?
Yep.
Now, when I push on this side, does it feel better, worse, or the same?
The same.
When I push back, any pain, or does it feel better?
Feels better.
So this little thing is distracting the L5, L4 area off of the sacrum, just to kind of test and see if that would help. Now, if I did this and it made it worse and made these muscles grab, then that's a problem. So to kind of do the opposite, does that hurt?
Doesn't hurt, no.
Just doesn't feel comfortable, right?
Right.
No issues there, right?
No.
So this is good, and her knee moves pretty well. Quads are a little tight. Got some room before we can get this heel to the buttock. So this side, though, is where we were having more of the hip issues. So not only as we kind of blend into that, we could see the quad, but if you watch when I take her leg up and how this kind of bends versus what I do here, this is pretty relaxed and it doesn't cause her back to change. So with somebody who's doing a lot of squats, trying to get the depth and push equally off her legs, if this whole kind of hip, psoas, quad thing isn't firing that much, she's going to have to compensate with something else, and it's probably going to be more of like her, maybe that's why she's feeling that numbness in the quad and such, is because of that compensation. But so far, I mean, this is a good sign that it maybe isn't a disc issue, but we're still going to kind of treat as if, and then we just might have to put her on the old lady hip exchange here soon. We'll get you fixed up. She's like, I don't want to hear that. Let this relax.
For it.
That hurt?
No, it feels good for the stretch.
Like a stretch in there?
Yeah.
So what I'm doing now is, this is an easy stretch just for the psoas, and then now I'm bringing the quad into it, and that's when you feel it more, right?
Mm-hmm.
Yeah. So this, especially in a performance athlete like this, she's going to do a lot of stuff that's going to involve multi-joint movements. So making sure that the quads are loosened up and all this is working, as well as stretching the anterior side or the front side here and getting it all to work together as it should. So these should be firing in the back. This should be loosening up and making sure that it's going to loosen that hip up. So I'll end up doing some kind of ankle, knee, and kind of work from the bottom up to make sure everything's moving pretty well, okay? And you said your neck was hurting you before, but it's feeling better this week?
Correct, yep.
Good. And so if you had to say, how many workouts are you currently getting in a week?
6.
6 total?
Maybe.
Maybe a couple more?
Yeah.
How many recovery days are you getting in a week?
1. I know I need to up that a little bit, but 1.
Just wondering.
Yeah.
So now what we're going to do is I'm going to use this table to open up these facets and get some pressure off your low back, okay?
Okay.
This should feel pretty good.
Okay.
If you can just scoot down just a little bit. Perfect. Right there is good. Feel a little pressure here. So when we were talking about earlier with your lower back being a little compressed from all the lifting, feel pretty good.
Yeah.
Good.
I can actually kind of feel it when you do that down right here.
So when I actually do that, you can feel a stretch, or does it feel tingly?
A stretch. Or like.
So it's kind of back on the table to see what's going on in this whole area through here, even though she has a lot of pain in there. But getting some pressure off these facets so that disc can take some pressure off the nerves too would be very, very helpful for somebody who does this. Now, I do suggest usually decompressive therapy for a lot of people. Check with your doctor first, and they'll be able to confirm if it's good for you. But that may be something we'll explore with her. And any of these areas where I put my hand, are they a little bit more sensitive than the others?
All really tight right here. Yeah, that's probably.
Like right down there.
Yep.
Did you train today?
I did not.
Still got train, because you can still train after we adjust you. So.
Okay.
Too worried about that. All right, so let's get to your adjustment. I know it's been a minute, so you're gonna hear some pops and cracks. That's just gas being released from the joint. So whenever a joint's fixated, basically it gets gas stuck in there. That gas also can cause the pain sensation. That's why when we release the gas, you hear a pop, and then also you feel better because that gas isn't pushing on the nerves, okay? So we're just gonna start with some light ones in there because it's our first adjustment together. It's first dance, I just wanna make sure that you're feeling good, okay? So we're gonna get right in here into your thoracics. Nice deep breath for me. And let it all the way out. Good. And so as we kind of talked, you have a little bit of rotation, which cleared up a little bit as you relax. So it tells me that as we let your psoas stretch a little bit by you being flat, it released. And even with me only doing a little bit, this is a little bit more equal. So that's good. Go ahead and lay on your right side of your body and face me if you would, please. I know, all this hair somewhere, right? Get that over there. Okay, so take your hands like this, and I'm going to adjust your sacral leg joint. We're going to drop this leg off. Let that relax. Nice deep breath. And all the way out. Okay, let's go to the other side.
Felt good.
Just that little pop, and you're like, ah. Well, good. So because she might have a little bit of hip stuff going on. Pull your arm out like that. I'm going to actually scoot a little bit closer to me if you can. There you go. Perfect. Just going to be very careful of that. Just relax.
Oh.
Oh.
I felt that was really good.
Needed that. And
Yeah.
go ahead and lay on your back for me. Let's get this stuff out of the way. Sit up for a sec so I can get all your hair out of the way. There we go. Perfect. And go ahead and relax. So when you were having pain, was it right in there the other day?
It was all over.
It was all over, she said.
Yeah.
This I'm going to be pretty light with.
Okay.
Like I said. Just relax. Good job. Good. Some pressure off you. Ooh. Are you a side sleeper?
Yeah.
Yeah.
I think so.
I think so too. Relax for me. Good. Okay, let's get the middle part of your back. Slide down table just a little bit. Right there's good. Arms, please. Give you a nice little hug. Slide my hand behind your back. Nice deep breath. Let it all the way out. A little hug for me. One more. Oh. All right. Have you ever had your ankles or knees adjusted in the past?
I don't think so. No.
Okay. So we're going to be pretty light with this. So as we mentioned, she has a history of a tear. So we don't want to do anything too aggressive with tearing on that. Plus she has some mobility issues going on in that hip. Until we know exactly what's going on, it's going to do some light adjustments through her hip, as well as kind of just make sure the mobility of her ankles and her knees are working too, because if there's a problem down there, the hip's going to take more aberrant motion, which means it's not going to move in the way that it should. And so the more we can kind of fix that from the ground up, the more she'll be able to push off her heels and turn the power up, okay? So let's get into this side here. Let this ankle relax for me. Good. Let this knee relax. So no problems with the knees in the past, except for this one.
Just this one, yeah.
It was pretty healthy. A little bit here. Good, up in there. All right, let's check out, see what's going on with this ankle. Good. Yeah, you get a little bit more motion here, so don't need to do too much with this. But it's good that you're doing some of this stuff too. A little bit different hip adjustment I'm going to do, because instead of just tractioning the hip, I'm going to get a little bit closer in there so we can actually just distract a little bit in a little bit different manner instead of being a little bit more aggressive how we were with the other hip. So what we're going to do, just going to let this relax for me. Good. Relax. Pressure here. Good. Good. Try and drop this leg for me. Feel a little looser. So we definitely need to do some work in there. If I had to say, you're feeling it quite a bit in here, right?
Yeah.
Okay. Have you ever had anybody work on your psoas before? Psoas, there's two heads of the psoas. It comes off, it all attaches right down there in the hip, and then comes off the side of the spine, and then it also works in there. So if you have any pain in there, you can definitely get some psoas work, and that'll loosen up, which I am going to work on her, but for today, I just wanted to see how the adjustment went. So we're going to do this after this treatment, but let me have you go ahead and sit up for me. And then go ahead and stand up for me. And I know it's been, let's try to bend over, see how you feel. How's the lower back feel? A little looser?
Oh, amazing, yeah.
You're like, oh, bent right over. How does that feel back there compared to how it was before?
A lot looser.
A lot looser.
Yeah.
Just a little bit
A
of
lot
hip
better.
stuff. Awesome. How's the neck feel?
Good. Other?
Awesome. We're going to continue to work on her psoas muscle, but if you guys have any questions, have any similar stuff, shoot us a DM below, or you can call the office so you can get in and see me. Check out Britt's Instagram so you can follow her journey on her next 3+ million races and competitions you're going to do.
If I last.
If she lasts, when she lasts.
Yeah.
So thanks for coming in today, and then we'll see you guys on the next video, okay? Next video.